The MINUTEMAN is a minimally invasive percutaneously placed interspinous process fusion device. It's designed for attachment to the spinous process through its spiked wing plates and its spiked end cap plate, intended for use with bone graft fusion material placed within the device. The MINUTEMAN stabilization and fusion of the spinous processes is designed to treat patients suffering from spinal stenosis, degenerative disc disease, and spondylolisthesis. The MINUTEMAN's unique threaded design allows easy placement through a 1-inch lateral incision into the non-cervical spine in an outpatient setting. Skin marks are made on the lateral torso that correspond with the edges of the target interspinous process space, and a small incision is made. A guide wire is then inserted through the incision and directed under fluoroscopy into the interspinous process space. A working channel to the spinous processes is then created through the successive use of soft tissue dilators of 3, 8, and 14 millimeters. A 20 millimeter diameter sleeve is then inserted and brought into contact with the lateral aspect of the spinous processes. The dilators are then removed, with the guide wire left securely in place. Attach the guide wire extension to the end of the guide wire by rotating in a clockwise direction. Alternatively, if facet hypertrophy prevents advancement of the sleeve, a bone rasp is utilized to reduce the mass of the facet joint to allow for docking of the sleeve against the spinous processes. A soft tissue rasp is utilized to partially remove the interspinous process ligament and to partially decorticate the spinous processes. Under fluoroscopy, a graduated tap is inserted over the guide wire. As the tap is advanced into the interspinous process space, threads are created in the spinous processes. Fluoroscopic visualization of the tap sizing holes during advancement of the tap determines the appropriate implant diameter size. The guide wire is then removed, and implantation of the MINUTEMAN then proceeds, unless it is determined that an implant size greater than 8 millimeters is required. In that case, successively larger soft tissue dilators and a sleeve of up to 26 millimeters are then utilized. The appropriate size insertion adapter is selected based on implant size and attached to the distal end of the insertion instrument. Align the etched arrows on each instrument together and push the insertion adapter into the insertion instrument until the tabs snap into place. The insertion instrument starts in the unlock position. To verify, the position indicator is aligned with the arrowhead at the base of the implant driver. The spring-loaded adapter shaft is compressed toward the spike cap knob until it bottoms out and is then rotated counterclockwise approximately 1/8 turn. The MINUTEMAN is attached to the insertion instrument by first aligning the wings of the MINUTEMAN in the same orientation as the slots on the plunger tip, snapping the implant into place. Proper alignment of the MINUTEMAN allows the surgeon to visualize the wing reference lines on the insertion instrument. Lock the MINUTEMAN to the insertion instrument by rotating the plunger knob clockwise until the position indicator is aligned with the lock symbol. The plunger stop automatically clicks to the right, locking the MINUTEMAN on the insertion instrument. The adapter shaft is rotated clockwise approximately 1/8 turn to allow the adapter shaft to gently spring forward to engage the MINUTEMAN's hex nut. Bone graft fusion material is placed within the MINUTEMAN. The MINUTEMAN is threaded into the interspinous process space by rotating the insertion instrument clockwise. Advance the MINUTEMAN implant until the spike end cap plate comes in contact with the interspinous processes and the wings are radiographically visible on the contralateral side. To deploy the wings of the MINUTEMAN, slide and hold the plunger stop to the left and rotate the plunger knob clockwise until the plunger knob stops. Verify under fluoroscopy that the wings have been fully deployed. For fixation to the spinous processes, hold the implant driver steady and slowly rotate the spike cap knob clockwise until the spikes of the wings and end cap plate are embedded into the bone. The degree of applied torque should correspond to the bone quality and age of patient. Confirm the spike placement by fluoroscopy. The insertion instrument is detached from the Minuteman by rotating the plunger knob counterclockwise until the position indicator reaches the lock position. The plunger stop automatically clicks to the right. Slide and hold the plunger stop to the left and continue to rotate the plunger knob counterclockwise until the plunger knob stops. The insertion instrument and sleeve are then removed, and steri-strips are applied to the skin. AP and lateral fluoroscopy images are then utilized to confirm appropriate positioning of the Minuteman.